Service industry is quite a different industry from others. It not only requires employees to use face-to-face or voice-to-voice communication, but it also requires employees to use emotions when they interact with customers. Appropriate emotions which employees perform may be required by organizations. The relationship between emotion and work was firstly identified and named by Hochschild in 1983. The concept of emotional labor may be an interpersonal transaction during which employees need to conceal or control their emotions in order to meet the requirement of organizational emotion management. There are two types of emotional labor strategies: surface acting and deep acting. Surface acting is a strategy which it does not require employees to change their inner feelings, and the employees just need to adjust their facial expression. Deep acting is another strategy which employees need to alter their inner feelings and become consistent with performed emotions. Emotional labor criteria could also be used in healthcare nursing industry. However, nursing industry is also different from other service industry. The first difference is service target is different. Nurses provide services and cares for those people who are ill. Patients' physical condition and psychological condition are vulnerable. To some extent, patients may not be normal people because if people are ill, they could not keep rationality. The second difference is the balance of power between customers and employees is different. The balance of power may lie in nurses because of nurses' technical position. Compared with nurses, flight stewardess may be vulnerable to losing their jobs if they could not meet the requirement of customers. Nurses would express some expressive emotions. However, these emotions are charitable emotions. Charitable emotions result from professional ethics rather than displeasures of hospitals. The previous literature has studied the factors affecting emotional labor strategies. Those factors could be classified into three types: personal factors, organizational factors, and interpersonal related factors. However, these factors are aimed at analyzing why different people would use different emotional labor strategies when they face the same situation. This dissertation is aimed at analyzing why the same employee would use different emotional labor strategies when they interact with different customers. This dissertation is based on attribution theory. According to Wiener, attribution theory is aimed at analyzing people's behavior and emotion. There are three types of attributions: locus, controllability, and stability. Locus could indicate the degree whether the causes of people's behavior is related to people. Controllability could demonstrate people's ability to influence the causes. The last one is stability. Stability could indicate that whether the causes of patients' whether the causes of people's behavior could be changed. When attribution theory is applied into nursing, there are few researchers have studied in Western nurses, according to their findings. Internal locus, high controllability and high stability would be positively linked with surface acting. Internal locus, low controllability, and low stability would be positively linked with deep acting. In order to explore the causes of patients' behavior and the Chinese nurses' emotional labor strategies, quantitative and qualitative methods were both used in this dissertation. A questionnaire based on attribution theory and in-depth interviews were conducted among Chinese nurses. Based on this questionnaire, 10 hypotheses were made in order to explore the relationship between the causes and the emotional labor strategies. By the virtue of sparse, the results showed that causes of patients' behavior would not affect Chinese nurses' emotional labor strategies. There is little difference between surface acting and deep acting in these attributions, which could indicate that causes of patients' behavior could not affect nurses' emotional labor strategies. In other words, attribution theory could not be used to predict emotional labor strategies in Chinese nurses. Although these findings may be different from the previous literature, it still has its implications in Chinese nurses industry. Hospital managers could use emotional labor scale to analyze nurses' true emotions when they take care of patients, and they also could explore other factors which would affect Chinese nurses' emotional labor strategies. That's all. Thank you.